respiratory system here is the frontal sinus. Then we have the whole nasal cavity here. And remember that this is called the nares, the entrance to the nose. We have another sinus back here, which is the sphenoid sinus. Then there's 3 ridges on the lateral sides of our nasal cavity, so they're concha. The A is the superior concha, the middle concha, and the inferior concha. Then the grooves underneath are called a meatus. So this is a superior meatus, middle meatus, and inferior meatus. Back here we have a little dent. So this is the entranceway into our auditory tube or the eustachian tube. Letter E, the bump next to it, would be a tubal tonsil. Here in the nasal pharynx region, we have our pharyngeal tonsil. Then what separates the nasal cavity from our oral cavity is the palate. So this is the hard palate, which is the bony part. The bone stops, and then this soft tissue is the soft palate, and this is your uvula. Down here in the oropharynx, we have a palatine tonsil. And those are the ones you can see when you open your mouth really large. And then this one is your lingual tonsil, which is at the base of your tongue. And then now we're down here at sort of the larynx. So in this little common area where the stick is, this is all of your pharynx. So the region that's right here is called the nasopharynx. The region behind the mouth is the oropharynx. And the region right here, just sort of at the level of your tongue, or below your tongue, is the laryngopharynx. And the pharynx will stop when you have the 2 passageways. So this one in the posterior surface, this is your esophagus, and then the one in front is going to be your larynx and then trachea. So this part up here is the larynx. The larynx is anchored to the hyoid bone. So letter K here is this little bone. It's a hyoid bone. Then we have the epiglottis, which is the elastic cartilage. That is a flap. When you swallow, it comes down and it just covers up the entranceway into the larynx, called the glottis. Then you can see that the next biggest cartilage here, this is the thyroid cartilage that sticks out, and that would be the Adam's apple, or in anatomical terms, it's the laryngeal prominence. The next cartilage down below the thyroid cartilage is the cricoid cartilage, and the cricoid cartilage is the only one that goes all the way around the trachea. Sorry, it goes all the way around the larynx. So this posterior part, that's the cricoid cartilage also. Inside, we have 2 folds. The upper part is your false vocal cord or false vocal fold. The bottom part is your true vocal cord or true vocal fold. And I think that's it for this region. If we just come back up a little bit, you can see that there's this blue blood vessel, since the vessels is also covered on this test. And that's going to be your superior sagittal sinus. Okay, so it's actually the 2 dura mater opens up, and that's going to be your blood coming in. And that's it.